Morning, everybody. It's day 302, and we're in week 43, believe it or not, almost to the 10-month marker. Unfortunately, it's another day that I have to tell everyone in Albany County that, unfortunately, we lost 6 residents last night. My condolences and prayers go out to the 6 family members, to the families that lost someone in these difficult times. There are a woman, her second youngest we've had, a woman in her 30s, a man in his 50s, a woman in her 60s, and a man in his 70s, and a woman and man in their 80s. This brings our total number up to 246 since COVID-19 started on March 12th. Again, my condolences and prayers go to the family. It's a difficult time. It's a difficult world that we live in today, and things have changed all around us. And to have to go through this and say that you lost someone to COVID-19 is difficult enough, and just to lose anyone in your family or someone you love is difficult. So as of today, we have 13,495 cases of COVID-19 in Albany County. We have 281 positive cases as of today. Yesterday there was 283. The day before that was 272. That brings our 5-day average to 251.2. Yesterday it was 239.4. There are currently 3,070 people under mandatory quarantine. Yesterday that number was 2,902. Of the positive cases, we know 38 had close contact to a positive person, 6 are healthcare workers, and 237 don't have a clear source of infection at this time. As of today, 41,689 people have now completed quarantine, which is awesome. Of those, 11,461 were tested positive with COVID-19 and have recovered, which is also awesome. That's an increase of 68 recoveries since yesterday. But unfortunately, the thing that we continue to watch and work with the 8 regional hospitals in Albany Med and St. Peter's is the hospitalizations. Last night we had another 24 new hospitalizations overnight. That now brings us to the total of 159 people currently hospitalized from this virus. Yesterday we're at 163, which was one of our highest. And of those hospitalized, 1 now is under the age of 25. We have 10 between the ages of 25 and 49, 51 people between the ages of 50 and 74, and 97 that are 75 years or older. Unfortunately, there are 15 patients currently in the ICU. Yesterday was 19. I continue to say to everyone, please wear your mask, cough into your arm, clean your hands, stay 6 feet apart, continue to do the right thing. Everyone that's out there doing the right thing, thank you. Everyone that's trying to be a great partner in this, thank you. Continue to do it. It's working. It is working. The flu season's down. Unfortunately, we're at the peak of COVID-19, a thing that Dr. Whalen and I have said for the last 2 months. And we're going to see this continue until we continue to get the vaccine out there into the community. And as that continues to get out there and we get to that 70%, our numbers will start to go down. And we'll start to get to some type of normalcy in our lives. But we do need buy-in from people to get the vaccine to make sure they want to do it. Yesterday we held our first pod at the Times Union Center, and I got to see Dr. Whalen wear another hat in a different capacity and walk around with her commander vest on, and what a great job her and her team did. To walk around there and to see the workers, to hear their stories, and the professionalism. That's how it's done. And to the medical corps, to our health workers, to everyone that was involved there, from ASM, which is used to be runs our Times Union Center, to Bob Belber and his team, to everyone, to the Sheriff's Department for their security, to everyone. It worked. It worked like it was supposed to. And again, I do want to say thank you to Dr. Whalen's leadership and her team, and everyone else. As we're talking about EMTs and others in Phase 1A who got the first COVID shots, it went very smoothly. And I know Dr. Whalen would love to talk about this, and I'm going to turn it over to Dr. Whalen to talk about what happened yesterday and what's going to go on into the future. Dr. Whalen.
Good morning, everyone. So yesterday was our first pod, which is point of dispensing. I'm always used to following that term, point of dispensing, with the word exercise, but this wasn't an exercise. This was the real thing. And we were so thrilled to finally get to this day. This is something that we have been working with and planning on for many years, but certainly the last 10 months, it has been a very daily observation and hoping on the countdown to when we were able to do this. So yesterday we vaccinated 1A workers at the Times Union Center, and I'm happy to say that we vaccinated 375 individuals. The numbers have to be reconciled, so they may be, that's early data, but I think that is going to be accurate as we reconcile our numbers this morning. It went very well. We got a lot of positive feedback that people were in and out quickly, and they felt that the flow of the event went well. So with any event, we always learn as we go through, and we are meeting later with the team to go through ways that we can improve things. I will say that this was, for us, a relatively small exercise, and we will be ramping up to have larger numbers vaccinated through our staff and our very dedicated MRC, and we look forward to doing that. We're working daily with the regional hub on this, and I think that everyone shares a common mission to get vaccine out and into arms as quickly as we possibly can. I think the day was a success. I think that it is a portent of future successes, and we really look forward to getting the vaccine out. We did not have anyone with any adverse effects yesterday. People came, they were vaccinated, they were monitored afterwards, asked to stay for a period of 15 minutes. We had medical evaluators on site if anybody had questions or entered any of the screening questions positive to discuss the safety of getting the vaccine with people as they came through. Of course, we had many nurses and several doctors there yesterday. So we really feel like we did a good job getting this up and going, and look forward to continuing with our efforts. Again, it's very important as we continue to roll this vaccine out to recognize the fact that this vaccine is safe and effective, and we do need widespread uptake of the vaccine in order to get to the end of this pandemic. So we look forward to opening up of additional populations to be vaccinated, which we're keeping a close eye on as well. And we're also continuing to work very closely with our cases through our case investigators, and working to control the cases that we see in the community. We also continue to work very closely with our school partners who are prepared to do testing and have been trained on the database this week that they will need to do that, and we are continuing close conversations with them about that and many other concerns. So it's certainly a busy time. It is, there's a lot going on from many different fronts, and we really are embracing the challenges that we face and working together as a very strong unit with cohesion with our local health department partners and with our regional hub. So I continue to maintain that I think the effort is good, and we look forward to continuing to go forward and get vaccine out as quickly and to as many people as we possibly can.
Thank you, Dr. Whalen. And just to let you know, we did get feedback. People said how smooth the operation was, how great it went. And it was, not that at any time getting a shot's a great experience, but you made it seamless, and which is good, to your team's credit.
I would like to, if you don't, if you don't mind, I would like to give a shout out to Tricia Bellato, who was, our employee, who is our director of the Division of Emergency Preparedness, who has worked tirelessly on pulling this event together. She did a fantastic job. She coordinated the whole thing, And, I know this week for her has been very little sleep, and it will continue to be that way through the month of January as we ensure we can continue this very important reach out. So thank you, Tricia.
Thank you, Dr. Whalen. And again, thank you to you and your team. Just to let everyone know, too, Albany Meds changed its protocols for the hospital starting on Monday because the alarming amount of patients, obviously, they have there, not just for COVID-19, but regular patients. Any new patients being admitted starting Monday will have the COVID-19 test. So just to let you know about that. And we're asking everyone, please go to Albany Med's website. Look at your category that you fall into. We're calling on people over the age of 75 we'll be reaching out to our counterparts in government to identify our workers. And believe it or not, we have a lot of workers that are over the age of 75. So we will be reaching out to them to identify them, to make sure that we can get shots in arms and that we get we get it out there in a timely manner. It was point of a conversation of a Zoom call I was on yesterday, and which we talked about, and we were talking about the guidance that has come out since the beginning. And I gotta say to Larry Swartz and Gareth and everyone else, and Dr. Zucker that was on that Zoom call, we did get the guidance we need to get shots in arms, and that's been one of the hardest things, because in the beginning of this, we were basically said if you don't stay in one category 1A, then you could be fined. You could take, they could move that away from you to have someone else do it. And the biggest argument we have as county executives, this is what we do. Our county health departments do this. I was actually had a nice phone call with Mayor de Blasio yesterday, talked to him for about 15, 20 minutes on the phone yesterday, and we were talking back and forth about this, and caring about our senior populations and caring about getting the vaccine and getting it to the people that are on the front line. I know in one of the things I used the word flush. It's just a terminology. I was just saying when we had 20, I thought it was 30, it was 24 or 20 vials that were pre-mixed, which have a 2-hour life shell that, under the guidance, we had to stay in 1A. You either had to get someone in there to get the shot, or Walgreens had to bring it back. So I was not about to send any worker out there at that point in time to get a shot, or anyone that we could find. And trust me, having an 83-year-old mother, I said a right age, and a 90-year-old mother-in-law, I could have found people to send out there, right? That wasn't the issue. It's the guidance. And when these EOs come out and guidance comes out in a partnership with state DOH and the governor, we got to follow it. We have no choice. We may not agree with it. We may agree to disagree, but we have to work in a partnership for the people of New York, for the people that we represent. And to my other county executives and county managers who've been doing a great job in upstate, and to Steve Aquario and ISAC, we've been addressing this issue. We've been talking about it. We talked about the medical corps. We talked about what we can do to get the vaccine out there. Dr. McKenna, thank goodness, has a great relationship with Dr. Whalen, so it worked a little bit better for us here because of the relationships. And that's a good thing about Albany, I guess, and Capital District. Only being a population of 1 million, it's people don't like it. Small Albany, everyone knows everyone. So again, these are things we had addressed that won't happen going into the future. So that's the most important thing. We just want to get shots into arms. We need to get 70% of the people vaccinated, so we're not in these issues going forward. So we can get out of this tunnel that we're in, because the light's there, and we're going to get there. But we need to get people vaccinated, and we need to get people to buy into the communities and for the vaccine. So please, again, it's just like anything else. I said this because someone else contacted me, and I go, it was a private conversation. We're having Zoom with top officials in the state to figure this out, because that's our job. That's our job, to work for the people that put us in office. To the 320,000 Albany County residents that I work for you. So my job is to advocate to get what I can to make sure when I put my head on my pillow at night that I can sleep, knowing that I did everything in my power to protect the people of this county, because your safety and health are the most important things. So I just want to make that clarified. And what you can do to help us is get tested. Please, our partnership with Whitney Young's been great. If you have insurance, good. If you don't, we'll cover it at Whitney Young. So please call 518-465-4771. Albany, that has been set up, the governor set up across the state of New York. You don't even if you have insurance, you don't have to pay. Go to UAlbany. If you have transportation, you can drive through 188-364-3065. And again, go to our website, albanycounty.com. Educate yourself. Find out where you can go to get the shots, what age group your kids fall into if you want your kids to get it. Wait times, it's there. Yes, I want to call that person out, but I want to say, look, I know it said a 40-minute wait and you waited an hour and a half. I apologize. You know, we just put the information up as we get it, and you know, it's going to happen. It's going to happen. Again, our mental health support, please. I've seen more and more people agitated, more and more people that are having a tough time struggling, and kids that are having a tough time struggling, you know, and that are just dealing with this whirlwind with, you know, not being able to interact or not being able to go out or hang out with friends. Kids with special needs break my heart the most because they need these services. They need interaction. They need continuity. And in this right now, what we're going through for the last 302 days, it's not that. It's not that. So take a time, take a step back, take a deep breath, like I say, and just realize, you know what? What's in front of us, what needs to change in front of us, and be part of the solution. Don't be part of the problem. And we'll get through this. But please call our mental health. It's there. It's available. 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. Our partnership with United Way 211 in the New York State hotline. Please wear your mask, cough in your arm, clean your hands, stay 6 feet apart, and do the right thing, and we'll get through it. We're almost there. Stay safe out there.